It's noon, it's the fourth Friday of the month, and it's time for another view on health. Today's topic, Alzheimer's disease. Alzheimer's occurs more frequently in African Americans than whites. Researchers say high blood pressure and high cholesterol levels are significant risk factors for developing Alzheimer's, and these ailments are prevalent in the Black community. So how do you know if you will develop Alzheimer's? What are the symptoms? Are there things you can do now to prevent it? We brought together experts to answer your questions. The ABCs of Alzheimer's disease, right after this news from NPR.
Discussing today's topics from an African American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Ham Lee. You know, it's happened to all of us. You're in a hurry and you're tearing up the house looking for your car keys, and for the life of you, you can't remember where you put them. Forgetful or a warning sign of Alzheimer's? Or you walk into a room and just stand there because you suddenly cannot remember why you entered the room in the first place. Should you be concerned? Today on Another View on Health, we're talking about Alzheimer's disease, the risk factors, warning signs, treatment, and caregiving. Please welcome to Another View on Health my co-host, Cardiologist Dr. Keith Newby. Hey, Keith.
How you doing?
I'm doing great. So glad to see you, and Happy New Year.
Thank you.
Since I haven't seen you in the new year. That's great.
Always a pleasure.
Phyllis Hines, who is a caregiver for her mother who has Alzheimer's. Hi, Phyllis. How are you?
Good. How are you?
Good. Thank you so much for joining us.
Thank you.
Gino Colombara, who is president and CEO of the Alzheimer's Association here in Hampton Roads. Hi, Gino.
I'm doing great. Thank you for having us here. This is a great opportunity.
Thank you so much for coming. And joining us by phone is Geriatric Specialist Dr. Hamid Okhravi. And how are you, Doctor?
I'm doing very fine. Thank you very
much. Good. Thank you so much for joining us. We really appreciate this. And we want you to join us. Join our conversation at 440-2665 or 1-800-940-2240. Any questions that you have about Alzheimer's or dementia in general. I want to start the conversation, and I want to start with you, Gino, because you gave such a really great explanation of this. The difference between Alzheimer's disease and dementia.
Okay. Well, if you think of an umbrella, Alzheimer's, dementia is the umbrella term. It describes the symptoms. There's various types of dementias. There's many different types of dementia. Each spoke on the umbrella represents a different type of dementia. Alzheimer's constitutes about 60 to 70% of dementia, Alzheimer's disease. So although Alzheimer's and other dementias, they all affect different parts of the brain, the ultimate destination is the same. So we as an association, the Alzheimer's Disease and Related Disorders Association is our official name. We can help families who are dealing with any type of dementia. So just think of a dementia as the umbrella term that describes symptoms dealing with dementia, some cognitive impairment, and Alzheimer's is one type of dementia.
And that's the majority. That's what the majority of people get.
60 to
70%. So, Dr. Okhravi, what exactly happens in the brain when you develop Alzheimer's?
Yeah, actually, this is a question that I'm being asked, by patients and also family members most of the time. What happens, in the brain? There are essentially, first of all, we don't really know exact cause, but there's a cascade, and this cascade starts with deposition of two different proteins in our, brain, which are abnormal proteins. One of them is called amyloid protein, and the other one is tau. And one of them is inside the cell, and the other one is deposited outside the cell. And they start and initiate a cascade, which leads to actually neuronal cell death, or nerve cells in our brain start to degenerate and then die.
So the nerve cells actually die from based on this,
right?
Okay.
And this happens in in a very specific way. Starts from the area of the brain which is responsible for consolidating short-term memory, and then it actually spreads to different other areas. And for that reason, patients, the early signs related to Alzheimer's dementia is mainly memory problem, because it starts actually in the memory center of the brain.
So we talked also with a Dr. Toni Miles from Georgia, and she actually described Alzheimer's and dementia in general now as almost at epidemic proportions. Let's listen to a bite from her.
The Centers for Disease Control has decided that this is a public health issue. It's moved from just being a clinical problem that individuals and their families and households are dealing with. It is now risen to the level where it's like an epidemic. And so the CDC did surveys in 21 different states. They asked a bunch of people in these places, do you have a problem with increasing confusion or memory loss? And these are not people who have a diagnosis. These are people who are aware that their brains are not working the way they used to, or it's causing a problem for them. And so the 90% of all the cases of people with this positive report were over 60, right? Mm-hmm. So people over 60 are the risk set, if to use a technical term. So in Georgia, we have 1.7 million people over 60 today in the state. And if you do the math, which is not as straightforward as it seems, about 13% of that group overall will tell you that they're having increasing confusion or memory problems that are sufficient enough to interfere with their ability to drive or be safe or handle their bills and stuff. And that's close to 500,000 people.
What is the difference between Alzheimer's and dementia?
There really is no difference. Alzheimer's is just a subcategory of dementia. So dementia is the big frame of reference, and there are all kinds of dementias. And right now, the thought is that Alzheimer's is the most common.
What are the warning signs?
Well, there are two pretty reliable ones that people, even in the earliest stages, will report, and that is increasing confusion and memory loss. Best example is a guy who drives a truck and he makes his routes, makes his deliveries, and all of a sudden he gets lost when there's street repairs and he has to vary his route. He's confused and unable to reorient himself. And so that's really kind of a classic example.
And you've heard people say, or I've heard people say from time to time, well, that's just a sign of old age. Mm-hmm. Is there a certain amount of forgetfulness that just comes with getting older, or should we really be worried when we start forgetting where we put the car keys, or that we put the ice cream in the cabinet or something?
I think everyone's allowed one of those once in a while. The thing is, if it continues to happen repeatedly, or if other people notice it and call it to your attention. If you lose your car, lots of people go to the grocery store and then they forget where they parked the car. Well, if you can't figure out a way to find it, then you have a problem. For me, what I usually do is hit the clicker on the back and make it honk at me. That's really it. It's subtle at the beginning, and it gets worse.
Now, Phyllis, you have a personal experience, don't you, with the car and with what happened to your mom. By the way, that was Lisa Godley interviewing Dr. Toni Miles from University of Georgia. What happened?
She went to the doctor's office, and when she came out, I'm not even really sure if she made it to the doctor's office, but she couldn't find her car at all. And then she took the bus home, and then my uncle called me and said, I think your mom's car got stolen. So we reported it as being stolen. She couldn't remember anything in terms of, couldn't give us any details. She just went to the doctor's office, and when she came out, she couldn't find her car. Mm-hmm. And so, calling the police, and, they put out a stolen bulletin or whatever it is that they do. And a few days later, it was parked a few blocks away from her doctor's office because she didn't park in the garage. She parked it on the street. And so that made us aware, okay, we have a problem.
So that was the first indication for you. Did you just think that she was just being forgetful, or it really alarmed you?
That alarmed me. Well, no, because we just assumed it was stolen. So we didn't really think about, she parked it somewhere and forgot where she parked it. And you had those other little signs before that, like she calls and can't remember where she put the checkbook, or she thought somebody stole her checkbook. So you go to the store and say, well, she was here. Did she leave her checkbook? And a few days later, it's found in a place in the location in the house that doesn't even make sense. Why would you put your checkbook there? So you have those little signs that is really not the norm,
Gino, it really is about changing the quality of your life and the extent of the forgetfulness and how it affects your life.
Most definitely. I mean, in terms of, we all, as we age, we all will forget, but the main thing is that we'll remember. We'll be able to retain some information. Someone with Alzheimer's can't retain information anymore, can't learn really new things. And the warning signs are, as the doctor specified, is if it's consistent and it is disrupting your daily life. That's what the main thing is, the disruption, because we all forget. So it's much more about memory loss or forgetting. It's about disruption of your daily life. And she was absolutely right in terms of the epidemic. I mean, this used to be called the silent epidemic. Now, at least people understand the word Alzheimer's and more people are getting engaged. But it affects 1 in 9, 65 and older, and 1 in 3, 85 and older. So with the baby boomers coming of age, and we have 77 million of them, you don't have to be a math whiz to see the ultimate results. Right now, we have about 5 million Americans dealing with it. By 2050, it could be all the way up to 16 million if we don't do something in terms of stopping Alzheimer's in the path and finding those disease-modifying treatments.
440-2665 or 1-800-940-2240 are the numbers to call. Give us a call. We're talking about Alzheimer's and dementia. What questions do you have? We'd love to hear from you. 440-2665 or 1-800-940-2240. So, Keith, in the research that I was reading, they were saying that that African Americans are affected more than whites in terms of dementia and Alzheimer's, and that vascular disease, high blood pressure, high cholesterol, those types of things, heart attack, are all significant risk factors for developing Alzheimer's. In your practice, then, with your older patients, do you look for that, or?
Well, it's gotten to the point where you just assume things are going to happen, so you're automatically looking for it from the start, because we run into this with people forgetting medications, and I get concerned a lot when we have hospitalizations, people whose blood pressures are sky high when they come in, and you put them on their usual meds, all of a sudden it's totally normal, and I'm like, you look at them and what's going on, and you kind of start to get to this point where you start looking at the home situation. And if family members are there, I'm like, are they taking their medicines every day? I mean, I've had all tricks that I've learned to find out what's going on. Call the pharmacies, how often are they getting their meds refilled? If, I look at the bottles, I'm seeing the bottle was filled, 8 months ago, and they're saying they're taking it every day, and I'm looking at this full bottle. I'm like, well, what's wrong? They say, well, I'm taking them every day. I'm like, well, I mean, this bottle's full 8 months ago. It's not magic bean pills, isn't that, automatically refilling themselves. Yeah. But you understand, though, and I joke around with them that way because I try to make light of it, too. But at the same time, it's a serious problem. So I look for that diabetics. They have a lot of microvascular disease, people with hypertension. So I'm looking for mini strokes. I mean, when I see there's an issue and I know they have a history of these, I'm looking at the risk factors, cholesterol levels, diabetics, hypertensive patients. I'm automatically looking for the possibility of microvascular disease, and that's the underlying cause. Now, that's not, of course, in everybody, because the Alzheimer's patients that's not their underlying premise. Right. But the form of dementia we run across a lot of is these other small but significant factors. And because I'm a cardiologist, I see those microvascular issues much more than plain Alzheimer's. Well, I should say plain Alzheimer's, but that particular form of dementia, because I see it so much because of what I do for a living.
So caregivers, and because somebody ultimately has to take care of the person who has Alzheimer's. Phyllis, I wonder, how has it affected your life? How has it changed your life? How long has it been first? Give us a
She said that's a loaded
perspective.
question.
I know, right? I've been home with my mom for, I think, 12 years.
12 years now.
Yeah.
Wow.
The funny thing now, where we have it worked out, it's really peaceful. I have the caregivers that I like. But when they go from being independent and when you feel like comfortable where you can go to work and come back, and then you come home, the neighbor said your mom got out and I had to get her back home. And then all of a sudden is, what do you do? So you call Alzheimer's Association organization and charity, Catholic charities, to find out where can I get a caregiver. And I think for people that's the most stressful point is, what do I do?
Because how did you decide where to turn? I mean, because you really, all of a sudden you have this problem, you don't know where to go.
Right. Well, my mom had a friend, and she said she would come to our house every day. But then once she had a brother with Alzheimer's, she had to stop coming to my house and go and take care of him. So now I'm thinking, okay, who do I get? Because you're asking somebody to come to your house that you know nothing about. If it's somebody that is not connected to your family in any way, and then you have somebody who has Alzheimer's and they can't tell you things because they forget. So I don't know if that person is taking advantage. So my stress level is up to here now because I have to invite somebody into my personal space, somebody I don't know. I have to give them a key, and I have to trust them to do what I asked them to do. And so that's very stressful when you go from the point from them being a little bit independent to now you have to get a caregiver. And then you put these notes all over the house. Don't do this. Don't open the door. One night, we had ADT. And so I was going, that's good. Because my mom's routine, you have to know what your people do. My mom's routine is if she goes to bed and she gets up, the first thing she's going to do is open that front door. And it was 12 o'clock at night, and she opened the front door. I was asleep, and the alarm went off.
Right.
I was asleep. I was really asleep. And the cops were at the door. And she said, somebody's at the door. I said, no, go back to bed. And so they heard me yelling, go back to bed. And so when I opened the door and I looked at, oh my God, there's the police.
Oh, God.
Yeah.
Everything's all right? I said, yes.
You have to keep a sense of humor, don't you?
Yeah, and I was going, oh my God, I got paper all around my head because you know how we go to the bed.
Oh, I'm going to say it on that one.
Wrapping up the hair. So, oh God. But yeah, that's the most stressful point is when you come from, okay, you have the diagnosis of Alzheimer's, and automatically, if you're like me, you think the worst. And then that adjustment to getting the caregiver. If we could make that a smooth transition, that would be wonderful.
Okay. Charm joins us from Yorktown, I'm sorry. Hi, Charm, you're on the air.
Hello.
Hi.
I think you lost.
Hello, I think we lost them. Okay, we'll go on. Dr. Okhravi, let me ask you, is there anything that a person can do who is not 60 or who has not reached the age where to prevent Alzheimer's or prevent dementia?
Yeah, that's actually again, another good question, how to prevent that. We have enough, actually, data in terms of those preventive measures that we can implement in our life, including the last one, which came a couple of weeks ago, and that was about the, brain training. And it was it's a 10-year, project. They looked at some brain training in terms of reasoning and executive function and also memory. And, compared them people who didn't really have any memory training. And they followed them for 10 years. And what they found was that, the risk of memory decline and functional decline was significantly lower in people who had some memory training. And these memory training, you got to remember that it was just only for a short period of time, like 10 sessions, a total of like 65 to 75 minutes. But the effect actually retained there for 10 years. So that's one thing that we, recommend. The other thing which is very, very important is probably even if we have more data is about the physical activity, the exercise. We know that exercise, especially in midlife, will decrease the rate of, cognitive decline and also, chance of developing Alzheimer's and other types of dementia. The third thing, which is very, very important, and again, we have enough data, is about the diet, about the Mediterranean diet. We have at least, 10-year, data that Mediterranean diet, people who, were mostly adhered to Mediterranean diet, after 10 years, the risk of developing Alzheimer's disease and dementia was 40% less than people who were not, following, Mediterranean diet. And as you know, that's a special type of diet. So there are certain strategies that we can apply, and we can definitely decrease the risk of, developing dementia and Alzheimer's, as Dr. Newby actually mentioned, especially in midlife, hypertension and high cholesterol and control of diabetes. Those are very, very important, factors, because they are not only risk factors for cardiovascular disease, they are also risk factors for Alzheimer's, dementia as well. The last thing that I would like to mention is about midlife or late life depression. We know that depression by itself also increases the risk of developing dementia and Alzheimer's disease, and also vascular type of dementia. So these are risk factors that we can control. We can, change, our destiny a little bit, by controlling these risk, factors.
Wow. Can you tell us just a little bit about the Mediterranean diet?
Yeah. That's a very, very, I think simple diet. Just, we can, follow. Essentially, what it, has, it's mainly, legumes, and cereals, and also vegetables, fruits, and also seafood. The amount of red meat and, poultry is much less, and also, olive oil. So that's mainly, kind of fruit and vegetables and, legumes as the basic, thing. So several, serving of, vegetables and fruits during that.
Gino, I think about this and I go, when are we going to get it? It still comes down to diet and exercise and taking care of ourselves.
Most definitely. I mean, really, if you're going to sum it up, what's good for the heart is good for the brain. And those things you can take control of. And I think dealing with high blood pressure, diabetes, if you treat it, you're going to also help reduce. But that exercise, staying engaged, doing crossword puzzles, being social, and taking control. And they're simple things that doesn't cost a lot, and you can take control. So what's good for the heart is good for the brain. And I think just to piggyback on what Phyllis said, about 60% of caregivers have reported that they've experienced a lot of emotional and financial stress, and about a third of those have said that they become depressed as a result of caregiving. And a lot of that is because so many people feel alone with this disease, and that's the point of what we try to do as an association, is try to have them engage with us, know that there are people here that can empathize with what they're going through, and help them really understand the disease process. Because right now, even though we don't have those treatments that can stop the disease where it's at, education is a treatment. And by being educated, knowledge is power, and knowing what resources are out there, knowing what kind of support can make all the difference, because that way you can develop an action plan. And that early diagnosis is important too, because the person with the disease can then take part in the decision-making process. Because I often say this disease is a family disease. Maybe not necessarily, it is. They think it is hereditary, but it's a family disease because it affects the entire family unit. Because Phyllis is now the advocate of her mother. Her mother can't be making those decisions on herself. So it's different in terms of someone having cancer or heart, which are terrible diseases. But those individuals can take control of their destiny and what they want to do. For someone with Alzheimer's, if you can get them diagnosed early and that know about what options are available, what clinical trials might be beneficial to them, what action plans they want to make, that makes the whole situation for the family much more easier in terms of caregiving, and increases the quality of life for all concerned.
Okay. Let's try it again. 440-2665 or 1-800-940-2240. Charm, are you there now? Hello, Charm, are you on the air? Okay, apparently we're having some problems. I'm not quite sure what's what's going on with there. That, but she's not there. Are you there, Charm? No? Okay, let's move on then. How did your family, Phyllis, deal with or come together around treatment for your mom? Or did they?
Well,
I'm making an assumption here. Or did they?
I have 3 brothers, and 2 of them do not live in the area, and one lives in the area who works long hours, and they have their own families. So I'm the blessing of the family, and they support me financially in terms of, whatever extra we need outside of my mom's pension. But for the most part, it really falls on me. But they do, I know my brothers love us and support us, but physically being able to assist me in that way, they're not able to do that.
Yeah, as a matter of fact, I was reading, Gino, you might chime in on this. I was reading where the caretakers who live away from the home of the person who has Alzheimer's winds up spending a lot more money.
Oh, for sure.
Where the caretaker in the home, it's the time and the and working with them inside the home.
Yeah, that's right. About 15% of caregivers are long distance caregivers, and when we say long distance, at least an hour away from their loved one.
Okay. Jean joins us from Virginia Beach. Hi, Jean. You're on the air.
Hello.
Hi. You're on the air.
Okay. My question was, about a week or so ago, there was a newscast about Alzheimer's tests that were made, and they had found that high dose of vitamin E was helpful for the Alzheimer patients. They didn't mention, however, what kind of high dose was needed. They also mentioned that this was only for Alzheimer's patients, because if a person who doesn't have Alzheimer's takes high doses of vitamin E, they have adverse effects, especially with the heart. But why doesn't the Alzheimer's patient also have the problem with the heart if they're taking a high doses of vitamin E?
Okay, let's see what the doctors have to say about that. Dr. Okhravi, are you familiar?
Yeah, actually, this is a study which came very interestingly on the 1st of January, and they looked at 600 patients with mild to moderate, as our listener actually mentioned, Alzheimer's dementia, not other types of dementia. They started in 2007, they finished it in 2012 in 14 VA hospitals, and the dose that they gave to patients were 2,000 units, 1,000 twice per day. So they divided in, 4 different groups, and one group was, vitamin D. And what they found was, during their follow-ups, in 2.2, I think that was 2.2 years, people who were on vitamin D, their functional decline was much less than people who were not on vitamin D. When I say functional decline, it means that the things that people do on day-to-day life, for example, bathing, grooming, dressing, taking care of their finances, taking care of their medications, or shopping, grocery store, and things like that. So essentially, this study showed that vitamin D will help to maintain function of people with Alzheimer's dementia. And what is very important, and I'm quite sure that Phyllis can tell us, about that, it's that in this study, what they found was people who were on vitamin D, their caregivers, had to spend, 2 hours less per day, for their, patients. So they gave them actually extra 2 hours per day, which I think is very, very significant if you're going to be taking care of patients, for example, for 15, 16, 17 hours per day. If you have 2 hours of, respite, it is very significant.
Respite in the sense then that they're okay, that they're able to function normally. Is that what you mean?
Correct.
Okay.
Exactly.
Okay.
So essentially, what happened in in this study, if you translate into a delay in clinical progression, they had 20% per year delay in clinical progression, approximately 6 months over the follow-up period, which is very, very significant.
Okay, if you're just joining us, we're talking about Alzheimer's disease with Geriatric Specialist Dr. Hamid Okhravi, caregiver Phyllis Hines, Gino Colombara, President and CEO of the Alzheimer's Association, and my co-host, Cardiologist Dr. Keith Newby. 440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. Bill joins us from Elizabeth City. Hi, Bill. You're on the air.
I have a brief question, and I'd just like to know how serious a problem is the misdiagnosis of normal pressure hydrocephalus, and is there any way to treat it, or how would the treatment differ? And I will listen on the air if I may. I'll hear you a lot better, but thank you for taking the call.
Okay, thank you for the call. Dr. Okhravi, that's you again.
Yeah, so essentially the question is about how serious is misdiagnosis of normal pressure hydrocephalus. It's a very actually tough question. Let me actually
What does that mean first?
Yes, exactly. What does it mean? It means that, the pressure in the brain goes up because of the accumulation of the fluid in our brain,
Okay.
CSF, cerebrospinal fluid in our brain. It goes up and it can affect, our mental activity. So there are essentially three different, symptoms, major symptoms. One is dementia, and then we have the gait abnormality and falls, and we have bladder incontinence. So this is actually three symptoms, main symptoms related to, normal pressure hydrocephalus or increased pressure in the brain. Now, it may happen. First of all, it's not very common. In terms of, studies, probably, it's probably something around 7 or 10 per 100,000, cases. Not very common, but it can actually happen, and that's one of the reasons we order some imaging studies like MRI sometimes in our patients, especially if they have classic symptoms. Now, when we diagnose normal pressure hydrocephalus, and these patients require to put a shunt in their brain connected to their abdomen, and to decrease the pressure in the brain. When they undergo this procedure, it doesn't mean that all of them are going to return to normal, especially their memory. The most common thing that actually kind of reverses mainly their gait and maybe their urinary incontinence, but the kind of memory problem may improve, and most of the cases it may not. So it's very hard to say how serious it is to misdiagnose, but I think it's very important if especially there are some, suspicious symptoms, as I said, those three symptoms. Just it's worth it to go ahead and order, the imaging studies, and if it is the case, then explore the therapeutic options, knowing that even putting the shunt, or doing the procedure may not return their memory and their function.
Okay, Gino, how do you talk to the doctor if you suspect that a loved one has Alzheimer's?
Well,
or dementia.
Well, something we tell our families is if they are suspecting that their loved one might be dealing with some type of cognitive impairment, is start keeping a diary, because that really helps the doctor when you go speak to them about what's going on. It kind of shows a pattern, and it really helps in terms of that. And then really, like Dr. Okhravi, he's with the Glennon Center for Geriatric Gerontology here at Eastern Virginia Medical School. So getting an assessment with someone who's experienced with Alzheimer's and dementia, that is really important to do. And also the most challenging part, though, for the family member is getting their loved one to the doctor and to admit that there is some type of issue, because Alzheimer's is a scary disease. And again, not knowing about it and not knowing that there is hope and there's a lot of things you can do to have an increased quality of life can make it even worse. And also sometimes what happens is that the diagnosis comes later in the process, when a lot of the degeneration has already taken place, and the medications that are currently available that it could possibly help kind of keep it at a plateau for a period of time are not as effective because so much more damage has occurred.
So should you start with your primary care and then
go
to a specialist?
Or if you really know that there's something going on, you can go directly. It depends on how your insurance is and what have you. Usually your primary care will refer to a specialist, or you can contact someone like the Glennon Center and get an assessment there. I guess the real thing that we can help families with is we have like a 70-page resource manual that we update weekly. And when families come in, we provide that, we go over that, we list all the doctors that are experienced with Alzheimer's in the community, so that way they know who they can deal with. And it's really important to have a good relationship with that doctor, because this is not the type of disease that you diagnose in an 8-minute visit. This is something that more so the doctor is treating the caregiver more so than the individual with the disease at this point. But again, getting engaged, getting the proper directions in terms of guidance in terms of what to do next, in terms of next steps, can be very important, because part of that emotional stress is feeling alone, is not knowing. And we have a lot of wealth of community resources here. Phyllis mentioned something about it with her mother opening the door. Well, wandering is a big issue.
I was going to ask you too. Why do people wander? I mean, is that a part of the
they want to go
going
home.
On in the brain?
They feel like they want to go home. They want to go back to something familiar. I mean, I'll give you a personal experience with that. I was, even before I knew anything about Alzheimer's disease, I was in the Navy, and I was stationed in Italy. My dad was living in Florida. We grew up in New York City. He wanted to go home. He was missing for 2 months.
Wow.
And he ended up, I had a detective looking for him. They found some suitcases in Philadelphia and then in New York, and it stopped there. What had happened was he got mugged in New York, ended up at Bellevue Hospital, where they kept him for a month. They diagnosed him with early senility at that time. That was 1986. He never stated what his real name was. He never stated he had a son in the Navy. But he did call his bank in New York to get his pension check, and that's how I found
And that's how you found it.
And, at that time, I didn't know nothing about Alzheimer's or senility or anything of that nature. But, we have resources like our Medical Alert Safe Return program, which is a registry program. So if my dad had that bracelet, the police, when he got mugged, they would have identified him right away. They would have called this 1-800 number. He had a unique code, and they would have identified him with him. We have a great resource in the community, too, Project Lifesaver. And that's a radio frequency device. It looks like a wristwatch. So if someone should wander off, they can detect and locate them quickly. So there are a lot of wealth of community resources. All our family services, like our 800 helpline, our family orientations, which are 2 hours long. They get that resource manual, individual care consultations, support groups, caregiver education are all free.
So if someone is in a long distance caregiver,
right,
can they log on to it's alz.org and find these same resources in their area?
And we have a really robust website. They want to come to our chapter. It's /SEVA after alz.org /SEVA. And most importantly, call that 800 number, 800-272-3900. No matter where you are in the United States, you will get a live person answering you no matter what time of the day or night. And if it's during business hours, you'll get connected with the local chapter. So if someone is calling us from Williamsburg, they're going to get our chapter because we cover southeastern Virginia. If you're in California and you call from Los Angeles, that same number, you're going to get the nearest chapter there. So you're always going to have some type of support.
Okay. Serena joins us from Norfolk. Hi, Serena. You're in the air.
Hi. My father was recently diagnosed with early onset Alzheimer's, and he started about age 43. But I was curious that about 5 people, they live in a rural area, and about 5 people on the street also have had Alzheimer's. So I was wondering, they spray a lot of pesticides and stuff in that area, if there's any correlation between a diagnosis of that with pesticides being sprayed.
Okay, let's check with our doctors and see if they've heard anything. Dr. Okhravi?
Yes. Actually, a question that I have is, I realize that your father is in his 40s when he was diagnosed. How about the other people who were diagnosed?
The ages kind of varied. The majority of them were a little bit older. I mean, not as young as he was, but.
Yes, because I think if, for example, if, there are 2 different types of Alzheimer's. One is early onset, and these are people who may have mainly, some gene mutations in their, in their gene, and then they develop Alzheimer's disease at very early, age. And then the other type, which is sporadic or late onset, and usually happens, when people get over 65, 70, 75, 80. And so essentially there is a difference between these 2. The underlying cause is the same, but, that the age of onset is different, and then, the gene mutation. If the rest of people there are, for example, they're 75, 80, 85, and then, dad is the only one, in his 40s. I'm not really quite sure if you can correlate, that, with any type of environmental, thing. But if let's say 3 of them are in their, 40s or 50s, yeah, that is significant. Definitely needs, further, assessment.
Okay. Thank you very much for answering that question, and thanks for that phone call. So we only have a few minutes left. Phyllis, what would you say to someone who is a recent caregiver? What have you learned that you can give some advice to them so that they can make a little smoother transition, if that's at all possible?
I think you really have to accept the fact that you are a caregiver. Not necessarily looking for help from family members. You have to own it. You have to be compassionate. You have to be respectful because that is still a person. Patience, these things are going to come. Mm-hmm. You're not going to automatically have it. You're going to grow into those things. Compassion, caregiving. Just being loving. Mm-hmm. Mm-hmm. Just accept the responsibility that you are a caregiver. That will help you.
And what do you do to take care of yourself?
I'm good.
Well, that's a great question because caregivers need to take care of themselves.
I mean, so you do get out.
That was so stressful for me because then everybody was saying, well, you have to take care of yourself. You have to do this. You have to do this. You need a break. You need a break. You need a break. So then trying to adjust to being a caregiver and then trying to get a break, that was stressing me out. So, if I wanted to go to the movies or I wanted to go to a concert, there's somebody that would stay with my mom. Mm-hmm. But that constant, you got to take care of yourself was really working my nerves. And really get rid of the negative voices, that says that, this person should be doing this and this person should be doing that. That also puts stress on you. You got to make a peaceful environment in your home, and you have to set up your routine that works for you and the person that you're taking care of, and be as loving as you can because they're not doing this on purpose.
Okay, that was Phyllis Hines, who is a caregiver for her mother who has Alzheimer's. Thank you so much for joining us. Gino, you got 10 seconds, a last-minute comment for people.
Okay, 800-272-3900. Call us. We're here 24/7. And some good news, $122 million was just appropriated, signed by President Obama for Alzheimer research, education, and support. So that's quite a commitment in this economic time. So that signifies the urgency of this disease.
That's right, and there is help out there.
There is a lot of hope out there.
Gino Colombara, he is the president and CEO of the Alzheimer's Association here in South Hampton Roads. Dr. Okhravi, I've got to cut you off, but I want to say thank you so much for joining us and all the information that you had to provide to us. We really appreciate that. And Keith, as always, we are happy to have you here, and you can stick around for just a minute, and we will be right back.
I'm with Marcellus, and you all are checking out Another View on WHRV 89.5. Don't go anywhere. Check us out.
And welcome back. It started as a conversation for men, an encouragement to get tested for prostate cancer, spearheaded by the Hampton Roads Prostate Cancer Forum. Then they reached out to women, because we all know that it's usually a woman in a man's life who will push for health screenings. This year is the third year for the Save Our Men Prostate Cancer Early Detection event. And Charlie Hill with the Hampton Roads Prostate Health Forum joins us to talk about this year's program. Hi, Charlie. How you doing?
I'm doing great, Barbara. How are you?
I'm doing fantastic. So it's been 3 years now. Are you getting more response? Are men paying more attention?
Yes, men are paying more attention, and I believe they are paying more attention because they're hearing more about prostate cancer and because the ladies in their lives are also urging them to pay more attention. So we're getting the double whammy here. The good news is that there's more positive activity. The great news will be when the numbers are consistent across the board and men come on their own without the nudging of the ladies in their lives.
Okay, so tell us the details about the forum that's coming up.
All right, February 1st from 8:30 a.m. to 11:30 a.m. at Queen Street Baptist Worship Center. That's Queen Street Baptist Church at 98 Armistead Avenue in Hampton. We're going to start with a workshop We're going to address all of the benefits and risks associated with testing, answer the questions that people have, educate both men and women, and then we'll give the men the opportunity to take the next step, which is huge, that is to have a PSA test, a blood test, and a digital rectal exam. And that's a complete day, and we think it's a wonderful time for men to give the ladies in their lives an early Valentine's gift.
And is there any cost for this, Charlie?
No, there's no cost for the participants, but because we have generous sponsors. So our sponsors have endorsed what we're doing, and they've simply said, if men have that need and they want to come out and do what they're supposed to do, then we'll pick up the cost. So for our participants, there's zero cost.
Hey, Mr. Hill, how you doing there, Chief?
How are you, Doc?
I'm doing well. I'm here to encourage everybody as well. Charlie Hill is one of the strongest advocates for this mission that I think I've ever met, and he's as dedicated as I've ever seen. But his commitment to making sure that this is stamped out as much as possible. I mean, I know no one else who's a better advocate for this particular process. And Charlie, you have my support 100% all the time. Anything I can do to help, let me know.
Thank you very much. I would simply encourage that you continue to do what you're doing, that is talk with your patients and talk with the ladies in their lives as well as others who are within the sound of your voice.
So, Charlie, what is the holdup? I mean, why do you think men still need all that prodding to go and get an exam? Is it that DRE? Is that what's keeping people from taking the test?
No, I think just how men are socialized fundamentally is probably the biggest issue. For some reason, and I know this was my experience, we are just encouraged to be strong, to be manly, to not to show emotions, not to submit to pain, etc. This recent discussion about NFL players, etc., and concussions is a great example. So the socialization of males, I think, is the bottom line issue, and is simply complicated by the fact that there are some perceived to be very, very unpleasant activities associated with the exam. I say very, very. They don't have to be that unpleasant with a professional who knows what she or he is doing. So I just think it's the foundation is the key there, Barbara.
And when do you, so once you take the test, when do you get the results? And if you get a result that is questionable, what is the next step?
The next step is, thanks to the generosity of our friends at Riverside Cancer Center, they will send a letter. Once the results are all processed, they will send a letter to the man indicating the PSA results and providing information about the digital rectal exam. And at that point, the man will have a letter that he can take to his doctor. And even if he doesn't have a doctor, we will work very hard to connect him with a doctor who will see him to discuss those results.
And Charlie, if the results are high, or towards the indication that there may be prostate cancer, is that a reason to panic at that time?
No, that's a great question, and I'm glad that you asked that question. Just because the PSA value is high does not mean a man has prostate cancer. Just because it's low doesn't mean that he does not have it. And in my case is a great example of that. I was diagnosed with prostate cancer with a PSA value of 2.1. No one believed I had prostate cancer. Certainly, I did not believe I had prostate cancer. And that's the reason why you want to be calm about this, get the results, talk with a professional, talk with a doctor, and work through this systematically in order to determine just what your situation is. Big point to remember, cancer is diagnosed via a biopsy, not through the blood test or the exam. A biopsy has to be done in order to determine if cancer cells exist in the man's body.
Okay. One of the important points I think needs to be made is that prostate cancer, I know a lot of people think that any type of cancer is just a kiss of death, and they have that, and that's another reason why men, we tend to avoid things, because we don't want the outcome to be known in terms of it saying this is, oh, I'm going to die if I have this. I mean, the nice thing about prostate cancer is nothing nice per se about it, but, it is a slow-growing process. And, you don't have to feel like just because you have it that means you're going to die. A lot of people, the survival rate can be extremely high if you early detection, early treatment, and you go ahead and get it done. I think the myths that you run across, a lot of men feel like there's going to be, sexual issues if they have prostate cancer and they can't do this or they can't do that anymore. These things have to be kind of washed away to say that you can't have a normal life, but you can't wait until it's to a point of no return before you decide to go ahead and get treatment. And would you agree with that, Mr. Hill?
I would certainly agree with that. I like to say early stage prostate cancer has no symptoms. However, if the cancer is diagnosed early, the chances of successful treatment are just tremendous. And that is why we encourage early detection. That's why we encourage getting PSA tests and exams on a regular basis so that you can track the trend of the PSA value and at the same time know your numbers.
And please, another thing is if you have a family history, please don't, if nothing else, yours should be there first. If there's a strong family history of prostate cancer, don't let that sway you. Go ahead and get that early detection exam done so you can try to get yourself straight.
And I'd like to put a finer point on that, Dr. Newby. I would say if your father or a brother has been diagnosed with prostate cancer, you should know that you have a 50% greater chance of being diagnosed with prostate cancer. So the point that Dr. Newby was making, don't mess around if you have some family history going on, but specifically father or brother, you have a 50% greater chance of having prostate cancer. But it's still not the end of the world, provided you do what you're supposed to do on a regular basis.
Okay, Charlie, you got about 30 seconds. Tell us again the details so that men from all over Hampton Roads can come.
Queen Street Baptist Church, Saturday, February the 1st. We need you to be there no later than 8:30 a.m. To register, you should call 757-827-0488. If that doesn't work, find Charlie Hill somehow, and I will connect you with the details that you need to have.
Okay, Charlie Hill, thank you so much with the Hampton Roads Prostate Health Forum. We really appreciate this information. Thanks for joining us.
Thank you again.
All righty. So lots of potentially life-saving information on today's show. If you'd like to hear it again or share it with a friend, please go to our website, anotherviewradio.org, and download the podcast. You can sign up for our eView newsletter, which is a once-a-week reminder of upcoming shows. And guess what? We're on Facebook, so like us. Next week, we're going to talk with a group of women who are passionate about ending violence among youth in our communities. So we need all of you to take care of your health. Take the time to get an exam, a yearly exam. If you think that a loved one needs help, reach out and help them. That's the best way to do it. Our theme music was composed and performed by Jay Sennett. Lisa Godley is our show producer. Victor Bowman is our audio engineer. And Austin Bell answered our phones. I'm Barbara Ham Lee. Stay warm and safe, everyone. Have a wonderful weekend. And let's get together again next Friday at noon for Another View.